usually ART we resort to when other treatment failed, or sometimes when a definite reason present that it need bypass procedure, as the initial case of test tube babies, which is now over 32 years old, whereby there's an absent fallopian tube on the lady, so there was no mechanism whatsoever in achieving motherhood or parenthood unless a bypass, i.e. a test tube baby. And that's what started the wheel from then on, and the motion. But since the indication had expanded, and nowadays we advise people in general, after they have unprotected intercourse for over a year with no result, to go straight to fertility center to have it investigated and seen the reason or the cause. Mainly, the commonest cause nowadays is anovulation. Anovulation means the lady doesn't ovulate regularly, monthly, like it should be, or infrequently. In this part of the world, this anovulation is the most common thing, because we see something called polycystic ovary, a word probably coined wrongly or synonymous, because it means, by definition, it means many cysts. It doesn't mean many cysts, it just means many eggs which fail to mature. And that's the commonest cause around in this part of the world. Actually, to my experience, and I work all over the world, it is very common. Or something which the shape of the uterus, or presence of fibroids, or ovarian cyst, or something, the cervix, the neck of the womb is hostile and being inflamed and kills the sperm, whether by the infection or by the presence of antibodies. The procedure of or what we call harvesting the egg or collecting the eggs is very simple. We give a small sedation and local anesthetic, and the lady is allowed to go home within 2 hours from that time. And obviously, if the man can produce a specimen of his semen, or we can extract it, as I mentioned before, with a needle or very small, minute cut, and they can leave at the same time, same day. We invariably mix the eggs with the sperm, or inject the sperm into the egg, and we keep them in a special incubator for about 3 days, up to 5 days. It depends on their development and the number, and then we replace them in a very simple procedure, like an examination, whereby we put a catheter inside the uterus, and it's not painful at all. We measure the success by take-home baby rate. Some people measure success by the pregnancy rate, but they may end in miscarriage. I personally subscribe to the idea that unless the lady comes one time with a baby in her lap, or that, no success. Take-home baby obviously is less than what we encounter sometimes of early pregnancy, and which some occasionally fail. In general, the age of the lady determines the success, regardless whether if it's her husband who have problem or not. It's her age what matter. Some people, regardless whatever we do, they don't become successful, and there's many reasons for that. But fortunately, it's getting rarer and rarer, or less and less. When we started IVF, it was the success rate 8%. Now we're talking average 42%.
For more details, visit www.dhcc.ae or call 800-HEALTH. Dubai Healthcare City, setting new standards in patient care.